Vitamin C and sepsis, presented by Alicia Calcagni. Vitamin C is a water-soluble vitamin that acts as an antioxidant by donating electrons and hydrogens to other compounds in the body who need it. And it's also useful in collagen synthesis, so in the formation of collagen, which is made by connective tissues and forms and makes up bodies, muscles, ligaments, and bones in the body. Research has shown that it can be helpful in reducing heart disease or certain types of cancer. However, it's unclear if it's specifically vitamin C or an overall healthy diet. It's helpful in breaking down iron so it can be absorbable by the body. And maybe for the number one reason it's known for is maintaining a healthy immune function. The RDA dietary recommendations are as followed and can be seen listed on the right. However, if you're pregnant, lactating, or a smoker, the dosage is increased. And smokers have an impaired ability to absorb vitamin C, so the RDA recommends that they have a greater intake to meet the baseline. You can find vitamin C in citrus fruits, strawberries, cabbages, leafy greens, green peppers, and tomatoes. And basically, you can find vitamin C in an overall diet that consists of whole foods, fruits, and vegetables. In a deficiency of vitamin C, a person may experience a weakened immune system. So if you contract the flu and the common cold all in 1 year, you may be deficient in vitamin C. You can notice inflammation of the gums, a fatigue, and impaired cellular function. So maybe a dysfunction in the brain or muscles. And in vitamin C toxicity, a person would be consuming more than 2,000 milligrams a day, and they could experience nausea, abdominal cramping, diarrhea, and in hemochromatosis patients, which is a buildup excess of iron in the body, they could experience even more iron because the excess vitamin C is absorbing so much iron. Sepsis is when the body is going into a high stress response. And sepsis is a result and can stem from any infection anywhere in the body. So it's how your immune system responds to an infection presented. Common places to contract infections that do result in sepsis are the lung, the urinary tract system, the skin, or the GI, which are already pretty vulnerable spaces. And sepsis cannot be spread, but the original infection, like COVID-19, can. At-risk populations include HIV or cancer patients, young people, elderly people, basically people who already have an overwhelmed or impaired immune system. Symptoms include rapid breathing and confusion, also can be followed by the fever and chills, fatigue or weakness, blotchy or discolored skin, sweating or clammy hands, and how people are diagnosed between if that's just a symptom of having an infection or of sepsis is the doctors will look for bacteria in your blood or other bodily fluids. They'll use an x-ray, a CT scan to look for an infection if you have a high amount of acid in the blood or impaired blood clotting, and an inability of the immune system to really function in a healing way. And they look for signs of when the immune system is like attacking itself and beginning to break down in such a severe and dramatic way, which would be sepsis. Treatment includes stopping the infection, and usually, since sepsis is so intense, patients are treated in the ICU with broad spectrum antibiotics, on a vasopressor to maintain muscle contractions, and filled with corticosteroids to treat the inflammation, as well as given insulin and breathing machine and kidney dialysis when the infection is presented in the kidney. Doctors are now researching vitamin C intervention on healing sepsis. Now they're pairing vitamin C with hydrocortisone and thiamine. Hydrocortisone is a steroid that reduces the body's inflammation response, and thiamine is a vitamin B complex that promotes muscle and brain function. These are cheap, accessible, and easy to use compounds, so doctors like them because they're usually readily available in the hospital. How is this possible? So already in the evolutionary response, vitamin C is released to maintain immune function and increase the blood flow and also protect the host from experiencing a lack of oxygen flow. The point, vitamin C can be used to strengthen and also calm down the stress response. So first, the stress response needs to be calmed down and then strengthened to actually, so the immune system actually does not attack itself and instead is healing the infection. HAT therapy was introduced by Dr. Paul Merrick from Wisconsin. And again, these three compounds working together can reverse the sepsis pathology, which is a severe immune and possibly life-threatening immune response. So these three compounds target many aspects of any normal patient's response to an infection, except in a sepsis case, the responses are just heightened. So they work together to restore any dysfunction that the immune system may be going through. So these are slides directly from his research, from Dr. Merrick's research, and he learned that timing, dosing, and volume matters. Also, on the last bullet, he talks about quality of care. So who is administering HAT therapy and where the patients are located also matters. So in dosing, vitamin C is the highest at 1.5 grams, hydrocortisone at 50 milligrams, and thiamine at 200 milligrams. And I think this is interesting because vitamin C is so vital to the immune function. And if the body is in a high stress response, it is unable to absorb vitamin C. So they want to make sure that the vitamin C is getting into the blood in a way that the body can use, absorb, and then eventually calm down. He also learned that timing matters, so he calls it a door to needle time, which he defines as less than 6 hours or within 6 hours of presentation. So he wants, and if not then, he wants the HAT therapy to also be administered at the same time at the first dose of antibiotic, which he found works best. So for the last slide, I'll show you the relationship between delays in administration and ICU mortality graph. So this is a graph of 90 patients who were treated with HAT therapy. And in the first block, you can see in less than a 6-hour window of presentation of sepsis to HAT therapy administered, you have a 0 mortality percentage, and it slowly increases as the window between the presentation and HAT therapy increases as well. Okay, thank you so much.